This is Radio Health Journal. I'm Reed Pence. This week, making your healthcare data more secure, because if it's breached, it's already too late.
The horse is out of the barn once the information's been breached. So there's not a lot you can do. Like, you can't change your name or you can't change your medical history or anything like that.
What a hospital data breach means to you when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
He had asked for a break. He was not given what he needed to stay safe, and he died, unfortunately, on his way home with his son.
Hotter temperatures are worsening conditions for millions of outdoor workers. What's being done? Then,
concrete, for instance, it's the second most highly consumed product on the planet.
Concrete, steel, wood. What makes some building materials better than others? I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
It's far from rare these days to hear about a data breach involving millions of people. Maybe you've had a credit card canceled because your card number is among the data suddenly available out on the internet. And do you want the whole world to know all your health secrets? The government reports that in the last decade, more than 265 million healthcare records have been stolen, lost, or improperly disclosed as a result of data breaches.
In terms of just in healthcare, the biggest ones have been insurance companies that have been breached, and they've had, they've acknowledged maybe 70 or so million records sometimes at one time are breached from a big insurance company.
That's Dr. Dean Sittig, professor of biomedical informatics at the University of Texas Health Sciences Center in Houston.
When a hospital's breached, like a good-sized academic medical center maybe has records for 5 to 10 million patients. And so generally they don't take all of those records. But the size of the breaches that have to be reported to the government are anything over 500. And so there's a website where the government posts all those breaches. And so in terms of hospitals, usually they're losing on the order of 1,000 or so records at a time.
Sittig says data breaches in healthcare, both large and small, are increasing. And as our health records are much more likely to be stored in electronic form, it's probably inevitable.
While it's easier to protect the computer, it's also more available. And so now people can breach a record from anywhere in the world, I guess. And whereas before, to breach a record when it was in paper form, you had to actually go to the hospital to breach it. And so it's greatly increased the number of people that have the potential to breach the records, even though the records in the computer form are much more secure than they were in paper. We're able to track it. We're able to keep track of it. So there's pluses and minuses, as with most things in the world, I guess.
Sittig says that often data breaches are fairly innocent. There's no evil intent.
Someone has downloaded some patient's information to their laptop to work on, like maybe the 1,000 patients that have diabetes that they're going to call in the next 3 months, and their laptop is stolen, and that's the breach, is that 1,000 records. The other way we've had breaches in healthcare is like if a healthcare system's trying to send some email to patients saying, you're due for your mammogram screening, and sometimes they try to send the same message to a whole bunch of people, and you should use what's called the blind carbon copy so that only the recipient can see the other recipients of the message. And sometimes people have put those other patients' names in the carbon copy or in the to field. And so like I get a message from my hospital, but I also see the email addresses of 1,000 other patients that also got the same message saying you're due for your mammogram.
You may figure that seems pretty innocent and unlikely to produce a real breach of data. But Sittig says security experts never make that assumption.
Generally, when you steal a computer, you're not thinking about that there's going to be something good on the computer. You're thinking you're going to get a couple $100 or maybe $100 for the computer. I mean, a used computer is not worth very much. But like we have to assume that when someone has the computer, they have access to everything that's on that computer. So some people have argued that, unless there's evidence that someone has actually used that information or posted it somewhere, that it hasn't actually been stolen. And so it's like saying, I stole the Brinks armored truck and I sold the truck to someone, but I didn't take the money out of it. Someone's got the money. And so eventually you assume that.
That's why CITIG's institution doesn't leave laptops unprotected by passwords ever.
What most organizations that are thinking about this is, like at my organization, for example, the University of Texas, we encrypt all of our laptops. And so when I log on, that allows me to get into the computer. If you come to my computer and open it up and turn it on, you have to type a username and a password to get onto my computer. And if you don't know that, you get like 10 tries and then the computer freezes up and you can't use it anymore. And the disk is encrypted. So if you like go into a back door and try to just look at the disk, it's all encrypted. And so you learn those lessons in an organization, usually the hard way. You have a breach and someone gets a computer, and then after that you go to the trouble. And it is trouble because you have to make sure every computer on your network is encrypted. Every laptop is encrypted. And so we also have special USB drives, those little thumb drives that you can use to exchange data. They're encrypted and it require a little password to get those, to use those as well.
CITIG says his hospital also routinely uses two-factor authentication. For example, a code number sent to a cell phone that has to be entered into the computer along with a password to get into sensitive data. He admits it's much more inconvenient but much more secure, another trade-off in what he says is a constant battle against the bad guys. And indeed, often a breach is a result of hacking, an intentional effort to steal data from the electronic health record. Sometimes hacks are carried out by disgruntled employees or former employees.
More recently, we've had some ransomware attacks, and sometimes as part of those ransomware attacks, they've copied parts of the database before they've encrypted it, or at least they've threatened that they've done that. I don't know how many of those have actually been released like that, but a lot of the times they're just trying to get your financial information. And so the hospital always has your name and your address and your social security number and some credit card information. And so a lot of the times, even though there's health data that we're worried about, they're trying to get your financial data.
And perhaps unique to health records, a data breach can be used to embarrass or even blackmail.
There's a lot of people that have things that are wrong with them that they would prefer their neighbors not to know. So maybe they're pregnant, maybe they have HIV, maybe they have been to the alcohol drug rehabilitation counseling, or they're either committed domestic violence or they've been victims of domestic violence. And so, everyone has secrets, and a lot of those secrets are in those electronic records. And so they can threaten people. So like if you steal 1,000 records, there's a few of them that you could try to blackmail those people.
CITIG says blackmail isn't successful very often. Sometimes hackers try to work a deal with the hospital, leveraging the threat of a federal data breach fine.
The HIPAA fine for breaches can go as high as, I think, $25,000 per incident. And so the people that try to steal this information sort of are saying, you pay me a little less than that and we can give you back your data and we'll be good.
Just as your smart thermostat and Alexa device can potentially be used by a hacker trying to break into your home Wi-Fi network, hospitals can fall victim to the same kind of thing. All kinds of medical devices are connected to the electronic health record today, and they're all what CITIG calls an attack surface.
If I give you an analogy of a bank, like if you're trying to rob a bank, usually there's a front door to a bank and a back door to a bank. And if you've watched a lot of good movies, you see that sometimes they drill a hole through the floor. So you've got basically 3 ways to get into the bank and 3 ways to get the money out. In a hospital system, generally you have terminals or computers all around the hospital. When you go into the hospital, you check in. Each one of those computers is a door into the data. When you start attaching other devices to your network that are connected to that same database, say like a infusion pump or a cardiac monitor or a ventilator or step tracker, those things that are starting to be what they call the Internet of Things, you've increased the number of doors or access points to the data. And so that's increasing that attack surface. And as you increase the attack surface, by definition, you make it more likely that someone could get in.
All of those doors to the system, or ports, are supposed to be protected, locked. But the more doors there are, the more likely it is that one of them will be forgotten.
But it's easy to, just like it's easy to forget to lock your door at night or when you go away for vacation, it's very easy to forget to configure your ports appropriately. And so now you've got an open door on your network, and people that are trying to break into network write programs that go to every port on a network and just like knock once and say, "Are you there? Can I get in?" And most of the time they say no, and they go away to the next one. But, with a computer, you can check, 100,000 of those every second. That's what the computer does best, is do a lot of work fast. And so, you only have to have one door open, and then they're in, and then they yell, "Hey, we're in," and everyone gets in. So the more doors you have, the more locks you have to have, the more doors you have, the more risk you have. And the Internet of Things is making things much more convenient, much more easily accessible. We're exchanging a lot more data. But as we do that, we also increase the risk.
Health systems spend major dollars trying to lower the risk of a breach, even if it's inconvenient sometimes. Siddig believes they should probably spend even more than they do.
That's why we have some of these government rules and regulations, like the HIPPA law that, requires the hospitals to protect their information. And there's stricter laws on healthcare organizations than there are on like Google and Amazon and places like that also have a lot of your data. And so it's sort of relative, I suppose. I guess the differences with your health data is some of it is more personal. Like you know more about me when you know my healthcare information. And so that's why it hurts a little more. You can be more embarrassed, I guess. Or you could lose your job, and you lose your job, then you lose your mortgage, and then you lose your house, and it spirals out of control. So sometimes these are the tip of the iceberg when they start getting your information.
Data breaches can cost hospitals plenty, too. An IBM report finds that the average cost of a healthcare data breach is more than $7 million. They have a lot of work to do when a breach occurs.
If it's more than 500 patients' information that's breached at one time, they have to report it to the government. And then generally the health system, they have to tell all the patients that they've been breached. And so you may have gotten a letter in the mail that said, your information has been breached. And then sometimes the hospital will give you credit monitoring protection, so you can look at your credit score online or see if anyone's opened your credit card in your name. So if I have your name and address and social security number and information like that, I can try to open a credit card in your name and start using it. And until you get a bill, you don't know that I have a credit card in your name. So I have, approximately a month or so to spend up to the limit.
So if your data's been breached, Siddig says the first thing you should do is take up any offer from the hospital for credit monitoring. Then start thinking about what else might be at risk.
If they say that, for example, they've stolen your password to the personal health record account that goes along with your record, and you happen to use that password for everything else in your life, which is definitely not recommended. You should always have different passwords for every account, but very few people do because it's so hard to remember your passwords. In that case, you should change your passwords. And so, you should always use a different password for your bank account than you use for anything else. But you want to think about what they've accessed. And it should say, when the hospital tells you, they should say, "I'm sorry, Mr. Jones, your laboratory data has been breached and your recent clinical laboratory test results are now available to someone."
If those lab results are just of your glucose levels, it may not matter much. If they include your HIV status or blood alcohol or cocaine levels, it may be more serious. With those, however, there's not a lot you can do. All the more reason to protect everything in the first place.
The horse is out of the barn once the information's been breached. And so there's not a lot you can do. Like you can't change your name or you can't change your medical history or anything like that. And so that's why these are bad, I guess.
You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence. Coming up next week on Radio Health Journal.
Being lonely is equivalent to the health effects of smoking 15 cigarettes a day or consuming more than 6 alcoholic drinks daily.
Loneliness, an epidemic in the elderly, and it's creeping into younger generations as well.
Then, trypophobia, the fear of clustered holes.
I do refer to it as the most common phobia you've never heard of.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.